RSV, I mean, there's lots of different things out there. The flu, we've got COVID, they all get a lot of noise. But with RSV, sometimes a lot of people don't know how serious it can be. Today, I'm joined by Lauren Brenton, who is an endorsed midwife and a mum of four, so she's had plenty of experience when it comes to navigating pregnancy, both professionally and personally. What has been your experience when it comes to the maternal vaccinations?
I think that once families understand the reason why we're suggesting vaccinations, once they look at the research behind them, a lot of families are really keen to have that vaccine and help protect their baby.
So how does it work exactly?
So when a woman gets the RSV vaccine in pregnancy, her body will create what's called antibodies and pass those down to the baby through the placenta. This will help to protect them when they're born, to help reduce the risk of hospitalisation from RSV in the first few months of life.
One of the women we spoke to out on the street actually had a child that was preemie and also had some lung challenges going on. And for her, it was, absolutely, how do we tell more people about protecting her child?
She was actually in hospital for 5 months when she was born. She was born preemie. Any kind of RSV vaccine she was offered, she was given. She's not the kind of kid that goes to the ball pits and that sort of thing in the shopping centres, because we just have to be really careful with her. She's got chronic lung disease. The more and more people that aren't getting vaccinated, the more danger she's in.
They can get really sick really quickly, and it is scary because you are helpless. There's not much you can do in that scenario, but just trust the healthcare team and be there.
I mean, what do you say in terms of what is a credible source of information?
I definitely say that your health professional is your most credible source of information. They have all of your medical history. They take into consideration everything. And I also say to trust your gut.
Where does the RSV vaccination sit in when it comes to the overall pregnancy care?
So the RSV vaccine is part of what we call our routine antenatal care. So it will be offered to you around 28 to 36 weeks of pregnancy. It's safe to have around the same time as your whooping cough and your flu vax as well.
And what do you generally say to parents that are feeling the overwhelm already?
I always say that you can't do anything perfectly, and we just need to be taking small steps to protect our baby and making sure that we're healthy and safe.
And so I'm sure you get a lot of questions in your birthing classes. I mean, what is it that typically concerns parents when it comes to maternal vaccinations?
The most common question we get is around vaccine safety, and I always reassure women and families that these vaccines go through rigorous testing. They're currently being used safely overseas, and they're now safe and free for pregnant women between 28 and 36 weeks of pregnancy.
That is excellent. Now, of course, the RSV vaccine is available for free on the National Immunisation Program, so you can inquire with your healthcare team, your GP or your midwife, to find out about getting this along with all of the other maternal vaccinations. For more information, you can visit health.gov.au.